Hello and welcome to Nikolai's Genetics Lessons, and today's question is: the leading reason for liver transplantation in the United States is, and you have to choose one of these answers. If you didn't know yet, hepatitis B is the #1 reason for liver transplantation in the United States and in the whole world. What is a hepatitis B? Hepatitis B is a virus or infection that causes liver disease and inflammation of the liver. Viruses can cause sickness. For example, the flu is caused by a virus. People can pass viruses to each other. Inflammation is a swelling that occurs when tissues of the body become injured or infected. Inflammation can cause organs to not work properly. And the liver is an organ that does many important things. You cannot live without liver, of course. You can lose, for example, one kidney and still live. You can lose appendix and still live, but you cannot live without liver. A liver transplant may be necessary if chronic hepatitis B causes severe liver damage that leads to the liver failure. Symptoms of the severe liver damage include the symptoms of the hepatitis B, which are generalized itching, a longer than usual amount of time for bleeding to stop, easy bruising, swollen stomach or ankles, and spider-like blood vessels called spider angiomas that develop on the skin. Liver transplant is a surgery to remove a diseased or injured liver and replace it with a healthy one from another person called donor. You can avoid getting hepatitis B by receiving the hepatitis B vaccine. Vaccines are medicines that keep you from getting sick, and vaccines teach the body to attack specific viruses and infections. The hepatitis B vaccine teach your body to attack the hepatitis B virus. If you're traveling to countries where hepatitis B is common, try to get all the shots before you go. If you don't have a time to get all the shots before you travel, get as many as you can. Even one shot may provide some protection against the virus. You can protect yourself and others from getting hepatitis B if you use condom during the sex. Do not share drug needles and other drug materials. Wear gloves if you have to touch another person's blood. Do not share or borrow toothbrush, razor, or nail clippers. Make sure any tattoos or body piercings you get are done with sterile tools. And tell your doctor and your dentist if you have hepatitis B. Just remember that anyone can get hepatitis B, but some people are more likely than others. You could get hepatitis B through contact with an infected person's blood, semen, or other body fluid. Most people do not have any symptoms of hepatitis B. Adults and children ages 5 and older may have symptoms. You should see a doctor right away if you or a child in your care has symptoms of hepatitis B. Children, especially infants, are more likely to get chronic hepatitis B. A blood test will show if you have hepatitis B. Many people with hepatitis B do not know that they are infected. Early diagnosis and treatment can help prevent liver damage, and hepatitis B is usually not treated unless it becomes chronic. Chronic hepatitis B is treated with medicines that stop or slow the virus from damaging the liver. You can avoid getting hepatitis B by receiving the hepatitis B vaccine. As you see now, it is much easier to get vaccinated instead of waiting for transplantation of the liver. And this is all for today. Thank you for your attention. Please subscribe for my new videos that I post almost every day. And see you in the next video. Goodbye.